Back in 2010, I had a really bad healthcare experience in the Philippines. At first, I thought I just had a bad flu, thinking I could sleep it off. But after 3 days in bed with no sign of improvement and a loss of appetite, I decided to visit the largest hospital in the city. The city had about 1 million people, so it's not a small town or village. I went on a Friday morning only to find out it was a holiday, so all the doctors were off and only a few receptionists were there at the front desk. I dragged myself back to my apartment, very sick, can barely walk, and I told the neighbor what happened. He told me I should try the emergency room. So the following day, instead of being in pain through the weekend waiting for Monday, I went back to the same hospital, but this time their emergency room on Saturday morning. However, just 5 minutes into my wait, a nurse came out me to say, "Sorry sir, there is no doctor available." It was unbelievable. No doctors in an emergency room. Imagine if I was in an accident, bleeding. I would have had to wait until Monday for any treatment, assuming I am still alive. Once again, still in serious pain. I had to drag myself back to my apartment to wait for another 2 nights. When I returned to the hospital on Monday morning, the doctor initially thought it was just a severe flu. Since I just came to the Philippines a few weeks ago and my body was not used to the tropical climate, she was about to prescribe regular Tylenol or some other basic flu medication. But I convinced her it was something more serious because I hadn't improved at all and I had serious pain in my stomach. She agreed to run a blood test and a urine test. A few hours later, after the doctor reviewed the results, she prescribed 2 medications. I picked them up for no more than $5 or $10 plus another $20 for the doctor's visit and the tests. The moment the pill went down, it worked like magic. The pain disappeared within seconds and I couldn't have been happier. However, after a week without sleep and barely eating, I was still exhausted from the experience. Waiting 4 days without basic medical care, even though I have more than enough money for them, was frustrating. I don't think I would ever have this experience back in Thailand. Reason number 2 for the negative aspects of retiring and living in the Philippines.